When a patient comes in, initially for the first meeting, there's kind of three phases that I tell them that we do that day. First of all, I tell them that we are going to go over all the paperwork that they have filled out. Then the second phase of the initial consult is when I tell them about the bands, the different bands we have, the Realize, the lap band. I tell them about, the procedure itself, things that they can expect pre-operatively, post-operatively. And I also take them into my fluoroscopy room and go through kind of the steps of a fill. So not only do they, have an idea about surgery, they have an idea of what's going to happen after surgery when they come to see me.
A lot of the families come. Usually it's the spouse or significant other. Sometimes it's kids. Sometimes we have pairs that come together, either a husband and wife or one of the parents and one of the kids are planning on going through the procedure together, and they will come and ask questions.
Sometimes when a patient comes in for their initial consult, they'll bring a daughter, a husband, a wife, a sister, a friend, and we involve them in the process. So right away that starts a support system for them, not only through us, but family and friends that they're close to will help them through their journey.
I want them to realize that it's not a magic pill, that they need to come in and realize that it is a tool that helps them as long as they still watch what they eat and exercise and are motivated to have that 1 cup 3 times a day. The husband and wife and children are all going to be affected by their new way they're going to eat and what's going to go on. And then I motivate them by saying, because if you look at a lot of times at an obese patient, their children are already getting obese because it's a way of life at their house. And so then I kind of support them and motivate them to realize if they change the way they eat, they're changing their children's lives.
I truly approach the lifestyle change in that first visit before they ever have the procedure. I really do discuss at length what it's going to require of them to make the band successful. And one of the questions that is asked of them to answer is, what are you willing to do for this? What does this mean for you to get the band done? What do you expect to see out of this?
Typical things that they come to us and ask are, about the fills. What are the fills like? What's the procedure for that? A lot of it is about, diet and nutrition. What sort of things can I eat? What can I eat? What quantities? And so initially, in our initial consult, I go through that with them. And I also give them a handout of everything I've talked with. So when they go home and they have questions, they can look at their paperwork, the handouts that I gave them, or they can call us anytime.
I spend a good amount of time on the medical history and take quite a bit of detailed notes, because that's going to be the story, so to speak, or the picture that I will present to the insurance. This is not a one-time insert, we'll see in a year, that this is a journey, and that they have to be committed to the journey and be committed to lifestyle changes. I ask people to do maybe 1 or 2 steps moving towards their goal of having the surgery. And I ask them to, make that commitment once they leave, because there is a period of time where they will have, the insurance is deciding, how and when they'll cover. So that equips the patient to come into this surgery more prepared than just having had the surgery and having to start with all the implementation. So I spend quite a bit of time on that, of what they need to do to get ready. And is this the right choice?